Welcome to the media briefing today. On the stage, the two doctors are Dr. Zhang Shouquan, Head of Communicable Disease Branch, CHP, and Dr. Lau Ka-hin, Chief Manager of DHA. First, Dr. Zhang will tell us about the cases. Good afternoon. Last night, we have 14 cases tested positive. From 13008 to 13021, 9 were imported. The cases all carried N501Y and T478Y strains. Among the nine imported cases, 5 were related to other cases, including 13101. That's the close contact of a patient at Flora Garden Phase 3, and 13011 is a 33-year-old male living above the patient. We have gathered 24 environmental samples. Some were collected from the U-trap in the units downstairs. They were tested positive, and the other samples were gathered from the ventilation shaft on the rooftop and the U-trap as the units above, they were tested positive. 13012, that's the 20-year-old male. She went to Nabe Urawa. The 5,000 samples gathered in the neighborhood were all tested negative. On the 4th of January, he sat at table 13, Nabe Urawa. The other sat at table 31. Like I said, between the two tables, there was a line of table apart. Yesterday, together with the MSD and the Food and Environmental Hygiene Department, the colleagues checked the movements of air and the ventilation. As between 1940 to 2134 on that day, there were 19 tables, altogether 44 customers. Some customers paid in cash, including the 20-year-old male. There were 3 tables where customers paid in cash, another 14 tables paid in credit cards. We are tracing these customers as we speak, and they will be subject to compulsory testing. At Nabe Urawa, we have gathered 41 environmental samples, all tested negative so far. 13104. For this case, we are still investigating. The close contacts have been sent to the quarantine center. Testing reports are pending. Another patient, 13021, that's a close contact of 13913. That's the foreign domestic helper of that case. She has been jabbed twice BioNTech. At the night of 7th of January, she was sent to quarantine center. She does not go out often, except watering the flowers in the little garden. Besides that, she mostly stayed at home. She was confirmed. She was tested positive at the quarantine center. We have fewer than 10 preliminary positive cases today, including 2. There is a nurse working at the Dr. Jiang Shiman clinic. That's a 21-year-old part-time nurse. She works in 4 clinics under the same brand in Tuen Mun. She would see the patients with the doctor on the 3rd of January at the Gold Coast Plaza. She saw a patient who was confirmed on the 3rd of January together with Dr. Jiang Shiman. The doctor checked the throats of the patients with no PPE on. That's why the doctor was quarantined. The nurse was standing a little bit far apart. However, she has been sent to quarantine center as well. She was tested preliminary positive yesterday. On the 3rd and 4th, or rather after the 4th, she went to the clinic at Sundo Building 101A in Tuen Mun, and the clinic at Yan Jing Street. That's on the 4th for the Tuen Mun clinic. For the Yan Jing Street district, she went at the clinic. She worked there on the 8th, 9th, and 11th. She's also a nursing student at the Baptist University, and she went to school on some days. Besides this patient, there is also a nurse who works in the same group, tested preliminary positive. There was no overlapping with the previous nurse. On the 4th, this nurse worked at the clinic at Sundo Building in the morning. In the afternoon of the 4th, as well as the 8th and 9th and 11th, she worked at the clinic at Yanjing Street, Tuen Mun. Her work nature is similar with the other patients. She would see the patient with the doctor, and she would collect the medical records and collect fees from the patients. On the 3rd and on the 5th, there were confirmed patients who visited the clinic at Gold Coast Plaza. After that, we have traced the other patients who were present at the clinic during the same time. On the 3rd of January, between 11:30 and 1 p.m., there were some patients, and on the 5th, 138 patients have been to the clinic. They were asked to get tested. So far, we have no positive cases yet. Because of the occurrence of 2 cases, we will require people who were at the clinics to be tested. For those who work at the same time with the 2 nurses, they will have to be quarantined. We have another preliminary positive case also found at the quarantine center. On the 5th, the patient has been sent to hospital. That's the family member of case 1283863 in North Point. That's the case in City Garden, Block 9. Another preliminary positive case, a 29-year-old Pakistani male. In the end of September, he returned to Hong Kong from Kenya. During his stay in the quarantine center, he was tested negative. He is a construction site worker at Kai Tak, and he is also a Food Panda delivery man. He lives in Tin Shui Wai. He is now tested preliminary positive with very low viral load. Last night, he had a traffic accident, and he was sent to the Pamela Golden Navajo Hospital, the ANED, and then he was sent to the ICU. The CT value was 36 last night, and this morning 13, and then he tested negative later. We are still waiting for his antibody test result. He was jabbed once in Pakistan. We have to look at the CT value level to see whether he is a re-positive case. More data will be available later. And also, the comprehensive genome sequencing done by the Polytechnics University about the case at the Penny's Bay Quarantine Center. The genome sequencing results is identical with cases subsequent after case 12676. The lady who works at Penny's Bay, the security officer, was tested negative on the 8th. According to her, on the 9th, she posted a notice on the door of one of the confirmed patients. At the time, the confirmed patient was inside the room. There was a gauze screen between them. They didn't have direct contact. She donned full PPE with a face shield and so on. We are asking her whether infection took place when she took off the PPE. That's all for my report today. Thank you.
I'd like to invite Dr. Lau to report to us about the situation at the hospital authority. Good afternoon. As of 9 a.m. this morning, 27 cases have been reported within our system of the HA. In the past 24 hours, another 11 patients recovered and have been discharged. So far, 12,327 patients have been discharged from our hospitals. As of 9 o'clock this morning, 426 COVID-19 patients are being treated at our institutions. North Lantau Hospital, Hong Kong Infection Control Center, the Hospital Authority Infectious Disease Center, the Community Treatment Facility at Asia World Expo, and public hospitals. They are all in stable conditions. And then I would like to talk about the case of a patient in the ICU of the Prince of Wales Hospital. As mentioned by Dr. Chuang, he's a Pakistani man, age 29. He was admitted to the Neftheso Hospital as a result of a traffic accident. He was admitted to the A&E department, and then he was admitted to the Prince of Wales Hospital. He's being treated at the ICU. After admission to the ICU, following our usual practices, he was screened and he was tested for COVID-19 virus. The initial result was positive. And then the patient was arranged to be admitted to an isolation ward of the ICU to receive further treatment. His condition is stable. Having learned that his preliminary result is positive, our infection control unit has started the tracking and tracing work. 11 colleagues, or rather 11 patients who were in the same ICU ward with him were all tested for the COVID-19 virus. All of them have negative results. 3 of them were in the same cubicle, and they were now transferred to individual isolation wards. And that ward has been suspended from use, and it will undergo in-depth disinfection and cleansing. Well, other than those who gathered samples from his nose and throat, no other high-risk procedures have been carried out on him. At the Prince of Wales Hospital and at the Neftheso Hospital, altogether about 40+ hospital colleagues have carried out treatment and assessment on him. All of them would have to be tested by us. The hospital will continue to monitor the patient as well as the colleagues' conditions. And that's it for today's report. Now I open the floor to questions. Please identify yourself as well as your media organization and wait for the microphone to be passed to you. The lady on that side. Good afternoon. I'm from Hong Kong 01. If I may follow up on the case involving Nabi Urawa. Well, in relation to the case of 12X38, it was first said that the friend of Celia Wong went there to say hello to the friend. But now you say that the friend was actually having a meal there. And at first, the compulsory testing notice did not cover Nabi Urawa. I want to know whether it is a case of hiding the effects from you and so causing a spread of the disease. Today, with less than 10 preliminary positive cases, does it mean that it is under control? hospital. I don't think we should talk about the judicial procedures concerning any particular case and whether there will be prosecution. If it is confirmed that someone has been holding all or part of the truth from us, we'll consider whether we should take legal action against them. Less than 10 cases. Well, in fact, we are really concerned about local cases. That is, whether there is local transmission, whether there are cases, for the time being, the origin is unknown. Most of the cases are imported cases, since we have banned flights from many places, so it is expected that there will be fewer imported cases. The next one, the lady on the far side. I'm from commercial radio. Well, in Tuen Mun, there is a very strong demand for testing. Now, if there is a citizen who has visited a couple of places, I want to know, does it mean that he or she would have to undergo 6 + 6 tests? So how are the tests to be arranged? And then for the case with unknown origin, that is the goods handler, for supermarkets. I want to know whether he has established a link with the Cathay Pacific crew member. And then for the Pakistani man, where does he live in Tin Shui Wai? And you talk about him being a delivery man. I want to know where he has been to, and have you traced the clients? And did he show any symptoms when he was admitted to the hospital? Well, I haven't got all the information you asked for. I think he lives in Tin Yat Estate, Tin Shui Wai. The actual block is called Yat Wen House. The last day he worked was the 12th of January. He had been working at a construction site in Kai Tak on the 11th of January. I think he worked for Food Panda, mainly serving Yuen Long. On the 12th of January, as a result of a traffic accident, he was admitted to hospital. He didn't show any upper respiratory symptoms. Tin Yat Estate, Yat Wen House is his address. We'll try to trace his contacts, including his close contacts. In relation to the compulsory testing notices, I think you really have to follow the dates specified. So you need to know whether there are overlapping days. If there are overlapping days, then of course one test would count, would do. What about the other question? Well, the origin of the case involving the goods handler. So far, we haven't identified the trace. The reporter on that side. Well, I'm from Cable TV News. Well, many residents living in different parts of Tuen Mun have to be tested. They may have visited certain places, they may have gone to schools, and then in one case, there's a person that has to be tested 8 times. It is said that the Bureau would be flexible and discretionary. I want to know whether you can come up with a very clear rule so that the citizens don't have to be tested, say, 8 times. Now, for the Pakistani man, it is said that he has been transferred from one hospital to another, and some medical staff would have to be tested. Does it mean that they have to stay away from work until there is a negative test result?
我哋會好密咁樣做嘅。
We are carrying out compulsory tests very frequently because Omicron has a short incubation period and onset is very swift. In some cases, people were tested negative on the first day and then positive on the second day. The same case happens in the Penny's Bay Quarantine Center. So please follow the instruction on the CTN and do the test. We have to do the test frequently because we want to identify find the case quickly. About the test results, when we are giving tests for our own colleagues, we would use the rapid testing kits. Results would be available in 1 or 2 hours. The colleagues would return to their clinical work only after a negative result is secured. I'm from Oriental Daily about the Tuen Mun situation. Now, there are long queues outside the testing stations. So besides extending the operating hours, what are the means are there to alleviate the situation? And about the birthday party and the 155 at Connaught Road West, compared with before, it seems that the number of participants is ever on the rise. Has anyone been withholding information? And what about the latest progress of the investigation? Well, the government is keeping an eye on the situation in Tuen Mun. As of this morning, everything was in order. I don't have the latest information. If necessary, we will deploy more manpower to Tuen Mun. About the birthday party in Wan Chai and Connaught Road West 155, we have discussed that extensively. Next question, the gentleman in the cardigan. Good afternoon, I'm from Now TV. First, the 2 preliminary positive cases who are nurses. First, the nursing student from Baptist University. Does she live in the Gold Coast? Will that exacerbate the situation in Tuen Mun? And what are her activities in Baptist University? Did she eat in the canteen, and did she have any contacts with her schoolmates? The other nurse, you said there was no overlapping of working hours. So what do you think the source of infection is? Now, after we have found the case, the cluster of case from the pharmacy, these nurses have not been sent to quarantine. Is there a loophole? About the security officer, you said the genome sequencing result is identical with the Cathay Air crew. So is she still counted as untraceable? Now, Nabe Urawa, are we still tracing the customers who were at the restaurants at the same time? Is there any difficulty because some paid in cash? One nurse lives according to my information, she lives in Long Seng Hua Yuen, Block 1. The other nurse lives in Hai Dak Hua Yuen, Block 2. They both live in Tuen Mun. We are worried whether there is invisible transmission chains in Tuen Mun and whether there are cases not found yet. Under normal circumstances, nurses would don PPE. When the doctor checked the throats of the patient, she was very close to the patient and she didn't have a face shield. That's why she was quarantined. The nurse, on the other hand, stood quite far away. Still, we ask all who have been to the clinic to get tested. Now, we have found 2 nurses. They did not work together at the same time, so we suspect there might be other cases from the clinic causing the infection. So for people who were at the clinic at the same time with them, they will have to be quarantined. The Penny's Bay security officer, we have done the whole genome sequencing, and we know there is another case in the quarantine center with identical gene sequencing results with her, so we would classify her as an import-related case. Nabe Urawa, some customers paid in cash, so we urge all customers who were there, that's at the night of the 4th of January. The 4th of January, between around 8 p.m. If you were there, please call us at our hotline. We want to trace all customers who have been there. That's between 7:40 p.m. and 9:34 p.m. on the 4th of January. If you were there at Nabe Urawa at that period of time, please approach us. Most customers paid in credit card. We will check the records and try to trace the customers. Several customers paid in cash. I hope they would approach us. What about the Baptist University student? She is a student in the campus on the 10th of January and the 11th. That's the 10th. She went to the campus on the 11th and 12th as well. So she was in the campus between 10th and 12th. That's the SCE building in the Baptist University, room 709 and 701. All students who were at these two classrooms would have to be tested. It's like in other schools. All classmates were wearing masks. They will have to be tested compulsorily, and those who ate with her have to be quarantined. Let's take an English question. The reporter there.
It's about for the preliminary positive cases of the nurses. How do you think that they were infected without an overlapping working time? And also the second question is, do you think the latest outbreak has been contained? Thank you.
The two preliminary positive cases, they work in the same clinic. Yeah, they have been to the same clinic and more than one clinics, but they did not have overlap in the recent few days. So one of the nurse was a company nurse. He's a part-time nurse who accompanied the doctor to see one of the cases confirmed earlier on the 3rd of January. So we considered that incident may be the likely source of infection for that nurse. As for how come the second nurse get infected, it is possible that there were some silent transmission in the clinic setting among the staff of that clinics. So both nurses worked in more than one clinic. That's why we have to check when the other staff had contact with them during that period of time. Yes. It is still a bit early to say whether the outbreak has been contained with the discovery of the recent even linked cases, because they are not from the quarantine center. They are detected in the community. So they have spent some time in the community, and that would also cause some transmission. Yeah.
Next.
The male reporter in the middle of that row. I'm from AM 730. About the two nurses, you did say that there wasn't any overlapping, but then on the 8th, 9th, and 10th, they worked at Yenching Street Clinic. Is it a matter of not overlapping when they were on duty? And how many patients will be involved and have to be quarantined? And what about the age, gender of the nurses? Are they part-time or not? And then for the City Garden case, I would like to know whether it's a matter of household contact. And for the nurses, other than going to school, what about other activities? For the Kai-Tak construction site, which construction site was he undergoing regular testing? What about the test findings? And then for the security guard, it was said that she pasted a notice which person was involved, and would that be the route of transmission? Well, we have a preliminary matching of the rosters of the two nurses. The dates are the same, but then they don't overlap in terms of the sessions. One may be working from 9 to 1, and then another 2 to 5 say for example, but then we have to double check because they might have mistaken their rostered hours. We have to check who were inside the clinic and who went into the doctor's room, and we have to see who should be quarantined. That is those who have been assisting the doctor. And then for the second lady, she's 22 years old. Well, for the one sent to the hospital from the quarantine center is a person who carries out administrative work. He works at the City Lab at Jordan. The last date of work was the 4th of January. On the 5th, he went to the quarantine center. Well, as to the other one, well, I think you are interested in the case of the Penny's Bay security guard. To which case was her case linked? 12960. As to the construction site worker, it's a new case. I haven't got the details. I only know that he used to work at a construction site in Kai Tak, but I have yet to find more details about the construction site. Sorry, the reporter hasn't used the microphone. Other than going to the university campus, whether there are other activities. Well, I've yet to find out more about her details. There were times that she didn't go to work. I've yet to find out more about the cases of the nurses. The next one. I'm from Ming Pao. Let me first of all follow up on the two cases involving students. For the 20-year-old Hong Kong U student, what about the genome sequencing? Has it been confirmed that the sequencing is the same as the two cases of the ladies who visited Nabi Urawa? And what about the clients present at the same time in the restaurant? Do they all have to be quarantined? And then for the 19-year-old male student in Yau Tong, can you now confirm that he has been infected by the case of 12913 belonging to the CITIC Securities? It is said that someone who wasn't in the same class as him but went to the same tutorial school had to be quarantined as well. Is that the case? And then a question about the nurses. Now, for the second preliminary positive case involving the nurse, do you think that it's more likely that she has been infected by the nurse belonging to the dispensary or pharmacy group? How many medical staff members are involved, and where do you draw the line as to who should be quarantined and who could be tested instead of quarantined only? And what about the assessment, your assessment of the risk level? Well, about the whole genome sequencing of the clients at Nabi Urawa, it hasn't been completed. We're yet to establish whether the transmission route is the same as that of the other clients visiting that restaurant. And then as to the ventilation, EMSD colleagues are still carrying out the investigation. I haven't got the data. Well, for the number of clients who were present at the same time, well, all of them have to be quarantined because we suspect that there was a transmission at that time. For the case in Yau Tong, we're yet to be sure as to whether he is related to case 12913. We have yet to wait for the findings of the whole genome sequencing, and we have yet to find out about the epidemiological link. As to the tutorial school co-students, well, I think only students in the same class would need to be quarantined. Nurses well, we don't actually have a serious community outbreak. Now, when we have two nurses working in the same clinic, so we suspect that it is more likely that she has got it from the other nurse. But of course, we have to wait for the findings of the whole genome sequencing analysis. As to how many people would have to be quarantined, we are carrying out a head count. Now, there are two nurses. They have been infected, and they were in the same clinics. So it is likely that there are people who run a high level of risk because they come into contact with the nurses for a long time. We have also got other arrangements like Chinese medicine and dental services. If they aren't that they are not as closely in close contact, then it's different case.
Hot Pot restaurant. So online photos of the restaurant show that there's sort of like a buffet area where people can go out and get some food. Is that a possible transmission? Because it seems like the two tables were sat quite far apart. My second question is about the Penny's Bay arrangements. So there have been complaints online that people whose quarantine orders are finished aren't being released. Seems like there isn't enough manpower, so will there be more people arranged there to get people out on time? And do you think the loophole of close contacts waiting to be sent to Penny's Bay, as well as their household contacts being allowed to move freely around, needs to be plugged? And my third question is about the genetic sequence results of the construction worker at Maple Garden. Is that available yet? So do we know if vertical transmission has actually happened there? Thank you.
For the dinner, the restaurant, the Hot Pot restaurant, I understand they do have a place where people can get some dessert and also some food and back to the table. So we cannot exclude that is also a possible sources of transmission. That's why we would need to quarantine all those attendees in that buffet during that period of time. I understand the relevant parties are working busy on the quarantine facilities and the logistics and so on because of the huge sudden increase in demand and they are trying their best to sort it out and I hope the affected citizens can understand. And for the worker in the Maple Garden, the whole genome sequencing is still pending.
So for people who are still waiting to be sent to quarantine and they're allowed to go out to find necessities, but their household contacts are also allowed to freely come and go, is that a loophole that needs to be closed?
I don't understand your question. Can you repeat again?
Sure. So there are still some people who are waiting to be sent to quarantine. So I understand that those people are allowed to go out to buy necessities, but if they have household contacts, those household contacts are allowed to come and go as they please. So is that a loophole that needs to be plugged?
I think all the close contacts and the household contacts are advised to stay at home to wait for the transfer rule. If they really need to go out, they better ask someone to help them.
下一位，嗰邊最後嗰個着恤衫。
The next one, the male reporter in a white shirt. I'm from TVB. First of all, in relation to the case of Dr. Zheng Ximan, what about patients that the doctor has seen? Are they at high risk? And do you have an idea about the number of patients?
嗰兩個
At those two time slots at Dr. Zheng Ximan's clinic, there were about 180 people. They have been contacted and CTN has been issued. We are gathering the results right now. The two nurses have seen some patients as well, so those patients have to be tested compulsorily as well. Dr. Zheng is not a confirmed case yet. So for those who were present at the clinic, some of them waited outside the clinic. There may be high risk factors, so they would be asked to get a test. Hi, I'm from Hong Kong Economic Times. About Nabel Urawa, you said there is a line of tables apart the two tables. So how far were they apart? Now, the notice has been issued at 6 p.m. However, actually, Cecilia Wong and the other patients went inside the restaurant at 7:40. So why did you set an earlier time? And it was said that the steam from the hotspot would kill the virus. So why is there still transmission? Now, have you gathered environmental samples from the clinic of Dr. Zhang? And besides the cases linked to the pharmacy cluster, what about the patients contacted by the nurses on the 8th, 9th, 10th, and 11th? Will they be tested and quarantined? Security officer at Penny's Bay, you said the genome sequencing result is identical. Is the genome sequencing of the result of the security officer the same as the patient 12960? And how long did it take for the security guard to post the bill? And how long did it take? And did they chat? What about the Pakistani male? You said the CT value has dropped to 13. So does it mean that the viral load has increased? In fact, you suspect it to be a repositive case. So was he confirmed before? 13011. You said it may be related to imported case, and there may be a vertical transmission at the Maple Gardens. So why you say that this may be related to imported case? The 4th of January, Nabel Urawa, I'm not an expert in this field, so whether the steam would carry the virus to other tables, I'm not sure. You should wait for the experts' findings. We think there is an outbreak in the clinic. We already have 2 preliminary positive cases. If both cases are confirmed, then we can be sure there was an outbreak. Immediately, a disinfection has been carried out. The 2 nurses' job is to accompany the doctor to see the patients. So for those who went inside the clinic and had contact with the 2 nurses, they will be subject to test. The whole genome sequencing test carried out by the Polytechnics University, 12676 and 12960 genome sequencing have been compared and found identical. So we have compared the genes of the viral strain of those quarantined inside Penny's Bay. 12960 is the patient whose room the security officer visited and posted a notice on the door. Omicron is highly infectious, so maybe the viral was airborne. So that's the epidemiological link we have found, and the timing was right. She was tested negative on the 8th, and on the 9th she had contacts with the patients, and on the 10th she was tested positive. It showed, that's the only link we can find. The preliminary positive case, the first CT value result was 36, the second one was 34. The third one, he was tested negative. Of course, we have to do several more tests. So maybe he is a newly identified case, a newly infected case. He might be a positive case because he returned from overseas. It was several months ago, back in September. His CT value was high, and sometimes his results come back positive, sometimes negative. So we suspect he might be a really positive case. But before we have a finding, we will treat him as a new case. 13011, we will wait for the genome sequencing results and determine whether there is a vertical transmission in the building. Yes, at present, the case is classified as an untraceable case unless we have proved that he is a really positive case. We won't just look at his infection record overseas. We will also look at the antibody levels and the time frame of the vaccination, as well as the test results in the coming few days. Sorry, the speaker is not coming through the mic. Nabe Ruwawa, why did we push forward the time? I have to go back and look at it. If there's no more question, this is the end of the media briefing. Thank you.